Peripheral IVs, or PIVs, are the most frequently used invasive device in hospitals. Addressing protocols associated with PIVs can impact 70% of patients. This may offer the greatest opportunity to improve outcomes, patient experiences, and efficiencies across a hospital. With the results of patient satisfaction surveys on what patients fear most, and 60% of first attempts to insert PIVs unsuccessful, peripheral IVs can cause pain and anxiety for many patients. They are also not without risk. An estimated 5% to 25% of peripheral catheters are colonized with bacteria at the time of removal. Applying BIOPATCH at insertion will provide sustained antimicrobial protection and a continuous 7-day transfer of CHG from the dressing to the patient's skin. Proper IV site selection, site preparation, and ongoing protection of the insertion site with BIOPATCH are vital. Consider the veins on the dorsal and ventral surfaces of the upper extremities, preferably on the non-dominant arm. Areas of flexion such as the wrist and antecubital fossa should be avoided. Excess hair at the site should be clipped and not shaved. A friction scrub should be performed with a chlorhexidine solution. IVs are inserted and maintained using a general non-touch technique. The IV insertion site should not be palpated after skin cleansing unless sterile gloves are worn. For application on PIVs, the recommended BIOPATCH size is the 3/4 inch disc with 1.5 mm center hole. Open up the BIOPATCH at the radial slit and allow it to close around the catheter for maximum efficacy, ensuring the blueprint side is facing upward. In order to ensure easy removal when used with a film dressing, place BIOPATCH around the device site in such a way that the device rests upon the slit portion of the BIOPATCH. Chlorhexidine is slowly released onto the skin over the next 7 days. Place a sterile, transparent dressing over the insertion site. Do not place non-sterile tape under the transparent dressing. Label per your hospital's policy. So what does clinically indicated replacement mean? It means that frequent comprehensive assessment is a must. Conduct a visual assessment, looking for signs of infiltration, redness, phlebitis, or non-intact or saturated dressing. Palpate for warmth or a palpable cord above the insertion site. Ask the patient if they are experiencing any tenderness, pain, or discomfort at or above the insertion site, or if they have any numbness or tingling. Remove the IV if a contamination or a complication is observed or when therapy is completed. This information is also available in a poster that can be easily referenced anytime. Your BIOPATCH representative and nurse have comprehensive resources to support your move to clinically indicated replacement of PIVs with BIOPATCH. Together, we will protect all lines, protect all lives.